It is 8:25. This is National Health Center Week. Did you know there are 17 community health centers here in Connecticut? And joining me now to talk about what they offer and how they might be really helpful to you and your family, I'm happy to have Joanne Borduas, the CEO of the Community Health and Wellness Center in Torrington, joining me now. Joanne, good morning. How are you today?
Good morning. I'm well. Thank you so much for having me.
And glad to have you here to shed some light on what you guys are all about. Why don't you just start by telling us the general mission? What is the purpose of the community health centers?
Sure. Our community health centers, are otherwise known as FQHCs, as you may have heard them referred to, are really mission-driven, established in areas where there are underserved communities. So our goal is to provide accessible and affordable health care, and in a unique way, so that it is convenient for our patients to access those services. So under one roof, you can come in and sort of a one-stop model, receive your primary care, your dental care, and your mental health care all in one building. We also have pharmacies and labs on many of our sites, so it makes it easy for you to get your prescriptions and your blood work before you go. And of course, one of the things that we focus on is also assisting folks to deal with social issues and inequities that exist in many of the underserved communities.
I imagine having everything under one roof like that makes everything fairly cost effective, but what else about the community health centers make them affordable?
Yeah, the cost of us providing care in the efficient way that we do has really, it saves costs for the state in terms of the healthcare in general, by preventing readmissions into the hospital and long stays in the hospital. But we can also work with folks on sliding scale needs if they are at a particular income level. So we do keep costs down by really working through our efficient processes, and then again, looking at that one-stop model to make sure that folks get the care that they need all under one roof. And then through the continuum of care in our chronic care management programs, we really help to manage those chronic conditions that oftentimes lead folks into the hospital and with long hospital stays.
And we, while you were talking, had a little graphic up that showed back to school supplies and or health. You can get that, COVID tests, COVID vaccines as well. Last quick question. How can somebody find a health center if they think they could benefit from one?
Right. So with the 17 of us, we are located in every part of the state. But if you also go to chcac.org, you will be able to find a listing of all the health centers in your communities that you can walk in and establish care with. And we're happy to meet those needs for you.
Okay, Joanne Borduas, thank you for taking the time to join us to let people know about everything that the community health centers have to offer.
Thank you so much for having me.
I'm glad to have you here. It is 8:28, still to come on Fox 61, getting you back to New Hartford this morning, where a historic building went up in flames. You can see the facade looks okay. Behind it, not